Over the last several days, there has been a decline in the rate of persons accessing the first dose of COVID-19 vaccines when compared to the more than 3,000 persons who were vaccinated on a daily basis about a month ago. On Wednesday, the Ministry of Health reported that a total of 229,053 persons were administered first doses of the vaccines as of the day prior. However, on Thursday, Health Minister Dr. Frank Anthony indicated that 793 additional persons had accessed the first doses as of Wednesday, totaling 229,846. There has, however, been a notable rise in the number of persons returning to the vaccination sites to receive the second doses. As of Wednesday, 1,780 more persons had completed both doses of the vaccines. The overall decline in first dose recipients, according to Dr. Anthony, is worrying, as it could stymie the ongoing efforts in aiding the country's attainment of herd immunity.
Initially, we thought perhaps because of the flood, people were not coming forward. But in some of those areas, the flooding has eased up, and we're not seeing people coming out. So we will do some assessment. We have been talking to the RHOs in those regions. They have been reporting that people are a little bit more hesitant.
The minister highlighted that plans will be initiated to diffuse lingering myths about the jabs. As of Wednesday, 21.2% of the country's adult population had been fully immunized, while those partially vaccinated accounted for 47.2% of adults. To achieve herd immunity, 80% or 400,000 of the estimated 500,000 adults living in Guyana have to be administered both doses. At the moment, the ministry only has in its cache first doses of the Sputnik vaccine and second doses of the AstraZeneca and Sinopharm shots. Another batch of AstraZeneca vaccines from the COVAX facility, which should have arrived earlier this month, is now expected in July. 100,000 doses of the Chinese Sinopharm vaccines, which have been paid for, are also expected before the end of this month. Meanwhile, Head of Medical Services and Cardiology at the Georgetown Public Hospital, Dr. Mahindra Karpan, revealed on Wednesday that even though Afro-Guyanese make up 30% of the country's population, they account for 60% of deaths at the COVID-19 hospital. Dr. Anthony highlighted that information from a preliminary analysis of over 200 of the COVID-19 fatalities thus far indicate that majority African Guyanese have died from the disease.
African Guyanese, the deaths have been at 36.6%, Amerindians at 28.2%, and East Indians at 23.3%. Mixed races being at 11.4%. So, as I said, this is an incomplete study.
He claims that most of, if not all of the persons who have succumbed were not vaccinated. The leading comorbidity of the fatal cases is hypertension.
People with diabetes, 28.2%. Those with chronic kidney diseases, we've seen those patients dying at 6.9% of them. And 4.5% of these patients had cardiovascular diseases. Those with ischemic heart disease was 3.5%, and those with immunodeficiency, they represented 2%.
Temika Rodney reporting for the HGP Nightly News.